A young couple gets in a car crash and is whisked away into the ICU, and they're nonverbal. Well, they'd talked to each other about their end of life wishes and their ICU wishes and things like that, but they'd never told anyone else. And so now family members and friends have no idea what to do and no idea what they would have wanted. Advanced directives are far more important than you might think or what they seem like on the surface, but let's dive in and let me show you what a nurse should do in these instances.
In today's lesson, we're going to take a look at advanced directives, and we're going to look at ways in which we can follow our patient's wishes regarding medical decisions and what documents are necessary to do so. Now, this is going to be a heavy subject, and not everybody likes talking about things associated with end of life, but it's really important, and it's more important for you as the nurse to realize this. There are going to be a lot of points to make in the lesson, but the big takeaway from this, that advanced directives are about the patient and what they want regarding their care when they can't tell you. So patients can often have conversations with family members about their wishes, but sometimes that information just doesn't get to the right people. Let's say, for example, you've got a young married couple who knows exactly what they want from each other in terms of their ICU care. But let's say they get in a terrible accident and they didn't tell any other family members. So now no one knows what medical decisions to make. And this makes the situation even more complicated for everybody. So it's really about the patient and their wishes. So how do we figure out ways to honor our patients and their wishes? Well, the biggest thing is that you can be an advocate for your patient. So you can be your patient's voice. So first off, start by advocating for them. Talk to your patients. Find out what they want. Find out if they've taken the necessary steps to get everything written up in legal documentation, so that you can actually, so that you know what they want and need. And if they've already got it, then that's great. Then you're one step ahead of the game. But if they don't, then hopefully by the end of this lesson, you can actually steer your patients in the right direction, so that they can know, so that they can make sure that their family members know what they want.
Hope is not a strategy. You either know you're going to pass or you think and hope that you are. NCLEX simulates the NCLEX for you, and your NCLEX Ready Score tells you if you are ready to take the NCLEX and pass right now. Head over to nursing.com to get your nursing survival package and NCLEX Ready Score now.
So the first thing we're going to talk about are living wills. So what is a living will? Well, living wills they're legal documents, and they're put together by the patients, and what they are they're essentially outlines, and they're outlines that discuss their wishes for care. They can be complex, they can be simple, but the goal of the living will is that it helps to guide the medical team and the family members in what care a patient would want if they couldn't talk for themselves. It's a great way to give a patient a voice in their own words, and it's before anything happens. For example, if a patient doesn't want to be on a ventilator or be intubated, then those things can be outlined in living will. And the other thing that's talked about in living wills sometimes are code statuses. And you're going to hear a lot about code statuses all throughout your nursing career. And code statuses they're basically policies in every hospital. But what they are is it helps to designate what the patient would want in the event of a life-threatening emergency. So when we talk about full code statuses, what full codes mean are that they want everything. So they want to be defibrillated. They want life-saving drugs. They want intubation. It also means that they also want compressions. And that also means that they also want to be hooked up to a ventilator. And when we talk about other things like a DNR status, what a DNR status is it's essentially the opposite of this guy. It means that a patient, they're refusing to be shocked. They don't want defibrillations. They don't want drugs. They don't want intubation. They don't want compressions. There are two things that you need to remember about this. One is that it requires an order by the doctor. The other thing is that it also requires a conversation between the doctor and the family member or the patient. That way, everybody's on the same playing field and everybody knows what they need. So there's one other little caveat to code statuses, is something called a partial DNR. Basically, a partial DNR is that they agree to particular aspects of a code status. So then maybe they want defibrillation and maybe they want drugs, but they definitely don't want compressions. Well, the way that it's written is it is a partial DNR. And the important thing that you need to remember as the nurse is that you need to pay attention to what they do and don't want. It'll be outlined again through the order and the conversation. So you can always refer back to documentation by the doctor for all the ins and outs of those. Also pay attention to your hospital policy regarding partial DNRs. Now let's talk about medical power of attorneys. So a medical power of attorney is a different type of legal document. But what it is it assigns a person to make decisions for the patient. And usually it's a family member or someone that they trust. There are two different types of power of attorneys. One's a medical power of attorney and the other one's a durable power of attorney. For the medical power of attorney, the patient picks someone and helps them make medical decisions. With the durable power of attorney, the durable power of attorney gives someone the authority to make decisions for someone else, but it excludes medical decisions. So these are like things that, for instance, like legal or financial issues. So if they need to get access to their bank account, or if they need to pay bills, or they have other court or legal issues, this is where the durable power of attorney comes in. It is not a medical power of attorney, and people cannot use a durable power of attorney to make medical decisions. You need a specific medical power of attorney. So who ends up making medical decisions for patients when there is no advance directive? So what we look at is we look at some state things. We look at some federal laws. You look at hospital policy. The biggest thing to remember is that you need to refer back to your state jurisdiction, because everybody's different. Texas differs from Oklahoma, and the United States differs from UK. So it's typically in the United States, it's typically a priority. So usually spouse, then next adult children, and then living parents, and then next of kin, and then medical team. That's for Texas. But for other states, it's going to be totally different. And different countries are going to be totally different as well. So just make sure that you look up any resources that you need to, and also talk to any management or senior leadership about that, and pay attention to the laws so that you make sure you're adhering to those. So who needs what? So who needs a living will and who needs a medical power of attorney? Well, in short, a patient needs a living will prior to the injury or illness or hospitalization or treatment. They can be healthy individuals or people with chronic illness. So people like COPD, no, they don't want to be ventilated at some point. They can actually put that in their living will. The other thing is, basically, everybody needs it. If you're a healthy individual, we don't know what tomorrow holds. So we need to make sure that all of our patients, we're always advocating for our patients to get a living will, so that even the young couple that was in the car accident from earlier, they're going to be the ones that, their family would know what would happen. For medical power of attorney, it's a little bit different. These are people that, who they may know at some point they may not be able to voice their own decisions. So these are patients with dementia or cancer. They want to designate someone who can actually be their voice for them when they can't. So let's take a look at some nursing concepts when we talk about advanced directives. Advanced directives are a direct reflection of ethical and legal practice. They're also a product of health policy. These situations could be complicated, so it's nice to refer back to laws that help us to dictate what steps we need to take. And lastly, we're talking about end of life care, and it's not always an easy subject to talk about, but it definitely goes hand in hand with advanced directives, and it's always important to know your patient's wishes regarding their care. So you need to be an advocate for them. Okay, so let's recap. When we look at what we need to know in terms of advanced directives, we need to know that these things honor our patient's wishes. You're always advocating for your patient and their wishes by knowing their advanced directives. If you know they have a living will, make sure that you get your hands on it, make sure that it's put in the chart, and make sure that the entire team knows about it. The other thing that we need to look at are living wills, and that these are things that are made prior to treatment. It's an outline of the care they want, whereas a medical power of attorney is someone designated to make medical decisions for the patient in the event that they can't do it. These are both legal documents, so we want to make sure that we understand the ins and outs of those. Also, we can't use a durable power of attorney. It always has to be a medical power of attorney. So who needs what? Living wills are for patients that are healthy or that they want to make sure that their wishes are known prior to something happening, whereas a medical power of attorney is for someone who at some point may not be able to voice their own medical requests or decisions. So patients, again, like patients with dementia or cancer or some sort of chronic illness. And the last thing we need to remember is CPR versus DNR. So you need to know your patient's wishes regarding emergencies and code statuses. You should always know your patient's code status, regardless of how many patients you have. And you need to know, especially if you have a partial DNR, what the ins and outs of each one of those aspects are. All right, guys. Thanks for hanging in there to talk about some tough but really, really important ethical issues. But by using the knowledge that you have now, you can help your patients to have their voice heard even when they may not be able to physically speak. So make sure that you go check out all the resources attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.
You're not failing because you're lazy. You're failing because no one gave you a survival plan that actually works. This video will help, but it's not enough. Head over to nursing.com to get your NCLEX Ready score and take a SimCLEX now to know you're ready, not just hope.